Compliance does not have to be a burden. It doesn't have to be hard. It can be a value differentiator and an opportunity to really help people. I think is the important thing that I would leave the audience with.
Hey, what's up, guys? Spencer Smith here, host of the Self-Funded with Spencer podcast, sponsored by Pareto Health, ClaimDoc, and PlanSight. Enjoy today's episode.
And then suddenly it was 2010.
Yeah.
And there was this bill that passed in 2010.
Yeah.
Actually,
Well, in case anybody's listening or anybody's 12 that doesn't know what happened in 2010, what happened in 2010?
The Affordable Care Act passed in 2010. And actually before that passed, the American Recovery and Reinvestment Act passed in 2009, which had some major changes to COBRA in it.
Okay.
So I did get to spend some time doing that.
Okay.
And there was a COBRA subsidy in that one. So I spent some time working on that. And then 2010, we get the Affordable Care Act. And at this point, it was interesting because the first generation of ERISA lawyers who had learned to become ERISA lawyers back in 1974, when that passed, are all retiring. They're like, I don't want to learn this new law.
Yeah.
It's 2010. I know everything there is to know about ERISA at this point because I've paid my dues. And now there's like this big new law.
Yeah.
And I know I've paid my dues. I know the foundations of the new law. And I'm like, I would like to be a health plan lawyer. I want to do health benefits. And it was like the perfect timing, like
And
right
they said,
place,
sure,
right time.
Jen, yeah, you're welcome to do this because probably nobody else wanted
Nobody
to do it.
wanted to do it.
Yeah.
Nobody wanted to do it. And so it didn't matter how many years experience the other people had. I had just as much experience as everybody else did.
Okay.
ACA was brand new law. And that's really how I positioned myself to become.
So kind of give me some specifics of things that you're doing as a result of ACA that changed kind of your role.
Oh, I mean, so there was just all new. I mean, this was when all the rules around preventive care were going into place. There are emergency coverage rules. I mean, there's just a slew of things that nobody had ever done before. So, I mean, things that we all know, like they're old hat today.
Yeah.
So, pre-existing condition exclusions used to be commonplace. Now they're illegal.
Right.
Right. So tons and tons of things just in the day-to-day administration of health plans that today are obvious because they're more than a decade old.
Right.
Were changing in 2010.
Well, yeah, and so I was just starting to work in the insurance space around that time, but I was more in the finance department of a general agent named Benefit Mall at the time. And so I didn't know what I know about healthcare today. So how was the industry reacting to this? How were consultants reacting to the ACA? Was there fear? Was there thought of opportunity? A little bit of both? What was it like?
Well, the sky was falling.
Sky was falling.
The sky was falling.
Yeah.
It was the end of the world as we knew it.
Okay.
People were retiring. People were panicking.
Yeah.
Some people saw the opportunity for what it was.
Right.
But, everything was changing. And we had to figure out how we were going to address that as an industry. And so I was like, all right, this is I'm going to make my career of this.
Well, yeah, no, absolutely. And clearly you did, right? But kudos to you for recognizing the opportunity as a result of that. Where does that fall in the timeline of, I know you were at that firm for what, about seven and a half years?
Yep.
Was that smack dab in the middle?
Smack dab in the middle.
But did you see also perhaps the writing on the wall that you weren't going to stay there forever? Or what
Not at that point.
Okay, what
Not
changed
at that point. I thought, all right, I'm going to leverage this, and I'm going to make I was on partner track. I was going to be a partner. I was going to be there forever, and this was going to be how I was going to make my career of it.
Okay.
And so I did. I mean, just doubled down and was working that much harder.
Yeah.
And that was the path that I was on, and I just kept working. Interestingly enough, that law passed in March of 2010. I mentioned that 13-year-old daughter.
Yes.
So
I could do the math.
Yeah. I was pregnant with her and ended up on bed rest, which is not something that we should do with type A personalities.
Okay.
So the timing really worked out because many of you might recall, that law was really big.
Yeah.
So I read it a couple times. So it really positioned me well. She was born that September. And by the time I got back from maternity leave, I just knew it inside out and backwards.
Okay, wow.
And
Well, you probably would have been one of the foremost experts probably in the world at that time if you've read it a few times.
That's all you had to do.
I mean, I almost want to say bless your heart, but I mean,
Yeah,
like somebody had to do it, right?
Somebody had to do it, and so I did, and just worked at it for a couple of years.
Okay.
And then continued to work on ACA implementation, and stayed at Venable through the fall of 2013.
Okay.
And then ultimately ended up leaving and joining a boutique ERISA practice. It was just me and a former partner from another major law firm.
Okay.
And built out my practice. I built out a law practice there.
Very cool.
Yeah, and I was there for, I guess, a little bit less than a year.
Okay.
Before MZQ was sort of
What I want to talk about,
accidentally
I was going to say
born.
the accidental origins of MZQ is pretty interesting story, right? And sometimes people have this like great epiphany, and yes, this is what I'm going to do. And sometimes the business just almost starts, and you go, oh, I guess I have a business now. So tell me a little bit of the origin story of what happened with you. Pareto Health is the manager of the largest employee benefits group captive in the United States, and it's also now the main sponsor of the Self-Funded with Spencer podcast. I chose to partner with Pareto Health for three main reasons. Number one, their dedication to improving the world of health benefits. Number two, their mission to reduce volatility and to make self-funding simple for mid-sized employers. And number three, the strength and scale of their program. With over 2,300 member groups and more than $1 billion of stop-loss premium under management, Pareto Health is the most robust solution of its kind in the country, period. Stay tuned for more information because I'm sure I'll be featuring them on an episode of the podcast very soon. Visit Pareto Health at paretohealth.com or follow them on LinkedIn to stay up to date on the latest news and developments.
Absolutely, and it was absolutely an accident in my case. So I was up in New York meeting with the brokers for a mutual client. And we had met with the client, and then we're out to lunch, just meeting over lunch, and they were telling me about a problem they were having, trying to determine who the full-time employees were for some school districts under the Affordable Care Act. So,
and why was it so difficult to figure this out?
So this is the definition of full-time employees under the ACA, which is, to be a full-time employee for the ACA, it's folks working 30 or more hours a week, but it is a complicated world with many, many pages of regulations for that. And this was for school districts, and school districts are hard. They have special rules. They have lots of variable hour employees. There were coaches involved. It was really tough.
Okay.
And this particular brokerage had outsourced this problem and white labeled a solution. And the folks that they had white labeled it with were not able to get the job done.
I see.
The data wasn't coming in a format they could use. Kind of famous story. And we're sitting there over lunch, and I was like, oh, well, I think that you would just do it this way, and kind of explained it to them. And they were like, we went back and forth a few times, and they were like, well, if it seems so easy, why don't you do it? And I was like, send me the data.
Yeah, I'll try it.
Yeah, okay, I'll try it. So they send me the data. I call my dad, because my daddy can do anything.
Is he Excel ninja?
He is an Excel ninja.
Yeah.
He's an Excel ninja.
Yeah.
Systems engineer.
Yeah.
VBA
I used
master.
to want to be an Excel ninja, and I got to where I was pretty decent, but I mean, people that spend 30 years solely doing Excel all day long, they're masters, right? So I presume that's probably the case with him, right?
I mean, he's a systems engineer from like back when they made systems engineers. like this is, I mean, the man put he put Hubble into space. I mean, he's like an Excel
So how hard of work was this for him? Did it take him some time, or was he able to figure it out pretty quickly?
I mean, I think it took us like 3 or 4 hours that weekend.
Okay. But you were able to turn it around a result when the other party could not, right?
Correct,
So
yeah.
how was this received by the client that sort of almost in passing gave you this project?
So, I mean, the brokers were pretty happy.
Yeah.
So I went up to New York the next week, and I got kicked out of the conference room. I think the client yelled at the broker for like 50 minutes of the hour-long meeting. And then they let me come in, and I presented the results, and I got kicked back out of the meeting like 4 minutes later. And afterwards, they explained to me, all right, here's the deal. The client wants to hire you, but they can't hire a lawyer. I'm like, okay, well, I am a lawyer.
Yeah.
So,
yeah.
I mean, I don't know what you want me to do, but I'm a lawyer. So they're like, they can only hire a consultant. I'm like, it's like, it's a procurement problem.
Okay.
I'm like, okay, well, what do you want me to do about it? Be a consultant. Okay.
Yeah.
I mean, I guess I could be a consultant too.
Yeah.
Like, there's no law that says I can't be a consultant.
But let's just be clear before this, you had no desire or consideration to be a consultant at all, right? Like
No,
you were just presented this opportunity and it was the solution to, I guess, ultimately you getting paid, right? For your effort. So did you go, okay, and just go and set up a consulting company? Okay,
Yeah,
cool.
I just went home and set up a consulting company and got paid for it. And I was going to like pay off some credit card debt.
Yeah.
It seemed like a good idea.
Hey, why not?
And that was going to be the plan.
Yeah.
And truly, that was the plan.
You thought it was a one and done deal, right? I got
did.
paid, got the money.
Just going to split it with my dad, and that was the plan.
Okay.
Yeah. But then they call me back and they're like, you got to build the button. It's like, what's the button? They're like, the button. They're like, well, you figured out who the full-time employees were. Like, now you got to do the ACA reporting. It's like,
okay.
I'm like, the reporting. I'm like, well, that's not so easy. Like, I can figure out what the codes are and all that stuff, but somehow you got to get it to the IRS. And that requires Java code. I don't do Java code. Like, no. And then we proceeded to have that conversation over and over and over again.
And I guess they just wouldn't take no for an answer.
They wouldn't take no for an answer. I'm having this conversation with my husband one night at dinner, and he says, TJ builds Java code. TJ's his best friend, like the guy who taught us to dance for our wedding. I'm like, well, TJ works at, another big company like down the street from where we live. I'm like, he works there. Like, what do you mean? Like, I'm like, yeah. He's like, well, he could do it at night. It's easy for TJ. I'm like, we're not gonna do this. So we go back and forth. We have this conversation like 5-6 times until finally my dad says to me one day, I think we're gonna keep having this conversation until you change your mind. Because we've had the conversation like 5 or 6 times. I'm like, not gonna do this. But meanwhile, in other news, my son at this point is repeating kindergarten, and he needs to go to the local school down the street that specializes in dyslexia.
Okay.
All right?
Okay.
But it's like
it's not
expensive.
Cheap. Yep, I already knew where this is going. Okay.
It's really expensive. I'm like, uh-oh. I'm like, all right, well, maybe you got to build the button because, like, I don't know how I'm going to pay.
But I presume the good news is if they're that persistent about it, then you could probably sort of name your price to a degree, right?
Right,
yeah, okay.
right. I'm like, okay, well, I don't know how we're going to pay for Genesee. Maybe you got to build the button.
Yeah.
I'm telling you, if Jack hadn't needed to go to Genesee, I don't think there would be an MZQ Consulting.
That's really cool. That's interesting, though.
Yep.
Okay, so thank Jack.
Yeah.
Maybe you'll have a job one day waiting for him.
Yeah.
But so MZQ at that point, so you went ahead and did it, right? I think before we skip over, I just wanted to ask the name. You had a pretty funny story how the name came to be.
Absolutely. Everyone's always trying to figure out the acronym.
Yeah. It's not an acronym, right?
It's not an acronym. Not an acronym. My sister, her name is Emily. And my father, we've established she's an engineer. So her childhood nickname, like on her lunch bags, was MZQT pie, like the pie symbol.
Like the pie symbol, yeah.
MZQT pie.
Yeah.
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 So, company's named after her.
Okay.
So that night in New York, she lived in Manhattan at the time. I went out for dinner and drinks with her. And I was like, I'm going to name this company after you. She's like, no, you're not. I'm like, oh, yeah, I am. And I did.
And you did.
And I did.
And it's still
there we go. That's
it's
the
still
story.
named MZQ Consulting to this day, right?
It
That's
is
really
still-
funny because I have a buddy who's his name is AG. AG Ford's his name. He's actually an illustrator for children's books. He's amazing. But his name is actually AG. It's not an acronym or anything. His name is AG. There's no periods or anything. And so like people always get that wrong or assume it stands for Arthur George or something like that. No. My name is AG. So MZQ is kind of the same way. So what did you do at first, right? So you built the button. I guess it's safe to say you did build the button. Did you realize then at that point this button could be offered and sold to other people? Was there utility that was scalable in that, or was it just for that one company you did that?
Oh, no. So first we started selling the ACA reporting.
Okay.
And we sold a lot of it before the button was built.
Okay.
Yeah.
Yeah.
We got a little over our skis. But we got it done.
Yeah.
So it was very successful right out of the gate. We were very blessed.
Yeah.
But
Very
there was
cool.
a huge need. There was a huge need. And we were very, very, it's kind of like when skill meets need and luck and all of those things sort of come together. So
and inspiration when in perspiration meet, I think that's the phrase.
Right,
Okay,
so what was really unique for us is that we understood the law.
Yeah.
And so there were a lot of people out there building ACA reporting products back in the 2015 timeframe who didn't understand the law. And we were in a position where I'm so proud of this still to this day. We never had an unanticipated 226J letter, right? So
I don't know what that means.
That
Can you
is
explain
all
what that
right.
means? Yeah.
So a 226J letter is an ACA penalty letter.
Okay.
So a lot of the early ACA reporting was done incorrectly. So people coded their stuff wrong. So we had employers who were in compliance with the employer mandate, but their ACA reporting was done incorrectly. And so literally billions of dollars in ACA penalties were assessed.
Whoa.
Because the reporting was done wrong. And then that all had to get remediated and dialed back. And we've actually done a ton of that remediation work as well.
Wow.
But our stuff wasn't done wrong. And that's actually a huge, huge point of pride for us, is that we set up our systems correctly in those early years.
Well, then obviously that boded well for the future of your company, right? If
Well,
you got it right off the bat.
Now, I will confess, our software didn't get it right off the bat. And that first year,
I don't think anybody's software gets it right off the bat. Like having come last job where seeing software being built and really complex software, the idea that you're going to get it right out of the gate is a fool's errand, right? It's not going to happen.
So the software didn't get it right. But we got it right. So at the end, there was one place that our software got it wrong, and we found out before we submitted. And I manually recoded over 800 employers' 1094s. We had it printed out on pink paper, and I will never forget 700 plus 1094Cs. My team printed them out, and I went through by hand and recoded that first year. It was. How
long did that take? Talking days?
A long time.
Too long. So that I'm really cool. Kind of right out the bat, you guys are successful. You got people demanding your services, which is great. You're probably building the company during that time, right, and figure out what do we spend money on, how do we grow. But let's fast forward to today because I want to really spend a lot of time on what you do for employers and consultants today. Walk me through very briefly through the evolution of then to now and what is different about the business now.
Absolutely. So ACA reporting was the first area that we were in. Then in the 2016, 17, 18 timeframe, we expanded out into other sort of, I call them the ERISA good hygiene products, but they're actually called our Compass and Compass Plus products.
Okay.
So plan documents, 5500s, PCORI filings, sort of a lot of the sort of building blocks of compliance. So we got into those spaces. And then in 2020 and beyond, all of the CAA compliance products. So that includes mental health parity compliance, which is a huge need, prescription drug data collection, and then now we're working on gag clause attestation, which, as we've discussed, is sort of the bane of my existence these days, but as well as compliance consulting.
Okay.
So we work with a lot of brokers, advisors, vendors in the space in helping them to help their employer-sponsored plans stay in compliance.
Yeah, so I mean, is that ultimately who your customer ends up being quite a bit of the time as the consultant themselves, or do you ever work with really big employers directly sometimes too?
Both.
Okay.
Yeah. Everybody.
Yeah.
We really focus on being the guide. And helping to make sure that folks have what they need to solve whatever problem it is that they're facing.
When I love, compliance, like I was telling you over coffee this morning, has become something that's just absolutely top of mind seemingly all the time. It's being discussed publicly on LinkedIn, which I love, right? There's some really good discussions that are going on. People are highlighting some of the things to be concerned about, but it seems like it's one of the most relevant topics in our industry right now is this compliance around this gag clause attestation, the CAA, no surprises. You mentioned a couple other categories I want to dig into as well, but it's all of a sudden compliance is cool. Which is, I'm sure you're enjoying it. Compliance is cool.
I've never been the cool kid.
Yeah, well, you are the cool kid right now. I can tell you that. But let's dig into those three categories you listed because I think each one of them is worthy of discussion. So let's define mental health parity first, and then we'll talk about some of the challenges around reaching parity.
Sure. So mental health parity is a requirement that mental health and substance use disorder benefits be provided in parity, so not equally, but in parity with medical and surgical benefits.
Okay.
So essentially what that means is that in each of 6 different categories, the mental health and substance use disorder benefits be provided on par with the corresponding medical and surgical
quality
benefits.
of those benefits needs to be around equal to the healthcare, right? Is that my
around equal to the medical and surgical benefits.
Okay,
Yep.
okay, yep.
And so they're looked at in 6 categories. And the 6 categories are inpatient and outpatient, in and out of network, so that's 4, and then emergency care and prescription drugs. So we look at them in those 6 different buckets. And then across 2 different paradigms. So the first paradigm is quantitative treatment limits.
Okay.
So quantitative is deductibles, copay, co-insurance, things, numbers-based, really tangible things. And the other is non-quantitative limits. So things that are sort of barriers to access. So definition of medical necessity, prior authorization requirements, things like formulary designs on the prescription drug side. And really the average plan can have anywhere from 15 to 25 non-quantitative treatment limits.
Okay.
And then you got to look at all of those non-quantitative treatment limits across all 6 of those different buckets.
Okay.
It's a pretty detailed analysis there.
So before we talk about how do we achieve parity or how do we define whether or not somebody's within parity, why do you think so much focus is being put on mental health as a category these days? Where's that coming from?
I think that one's pretty evident, right?
Yeah.
So, I mean, that is a societal imperative,
Yeah.
right? So we have
But do you think COVID amplified it? Did it originate from COVID? Did it predate COVID? Tell me.
I think it predated COVID, but it certainly has been amplified by COVID,
Yeah.
right? So I think there's a mental health crisis in this country that has been going on for really decades, but COVID just put a spotlight on it. Certainly the work that we've been doing in the mental health space has highlighted the fact that, most plans are not in parity. Even the ones that think that they are not.
Okay. Well, is even parity as defined by the statute itself possible? I mean, is it provable that you can, yes, we are, this check for sure, this is in parity? No?
No.
Okay.
Parity is defined by the statute as an aspirational goal.
Which can never be achieved then, right? If it's aspirational always?
Probably not.
Okay.
Not. No, I don't think it can be.
Okay.
So I'll throw out network adequacy as
Okay.
as a non-quantitative treatment limitation.
Okay.
You can't have network adequacy when we don't have a sufficient number of mental health providers. Like that's not something that's going to be achievable necessarily, but showing that you're working towards it, or compliance with something like the NQTL analysis requirement, which was created by the CAA. So the CAA has a show your work requirement in it that says you have to do an analysis. So the mental health parity as a concept and the Mental Health Parity Act predates the CAA by more than a decade. Like that, it's not new law. What's new is the requirement that a comparative analysis be performed and be
right, because I was asking this over coffee. You can't just be like, oh, well, we think we're in parity, and so if we ever have to like prove it or the analysis is done, we'll just be like, yep, see, we were in parity. No, you actually have to prove that you looked at it yourself as an employer, correct? Okay.
Correct. And so you have to have done this comparative analysis and have it on file.
Okay.
That is its own distinct legal requirement, separate and apart from being in parity.
Okay.
That you can do.
Okay.
Every plan should be able to at least show that they have done that analysis.
And is this an annual thing? Because obviously the medical benefits tend to change year over year as well. So then let's say I raise my copays or lower my copays or what, just as an example, do I also have to rework the mental health coverage itself to continue to be in parity year after year after year? Like how frequent is this analysis required?
Ready for the most lawyerly answer?
It depends.
It depends.
Okay, all right. Fair enough. Okay.
It depends, but likely the answer is yeah, it is annual because it has to be kept up to date.
Yeah.
And it requires operational data. And so you asked the question in such a good way for me to explain the answer.
Okay.
Because plans are changing. Plan terms are changing. the claims are changing, right? So I can't give you up-to-date analysis unless I'm looking at it every year.
Yeah.
So while everyone would like to say, nothing ever doesn't change in a health plan. I can't tell you how often somebody tells me, nothing changed about my plan this year in a plan document. And I say, are you really sure? You didn't change. Well, what about your vision carrier? Oh, well, yeah, I did change vision carriers. Well, 10 minutes ago, you told me nothing changed.
Right.
But you only changed your vision carrier? Yes, things change.
Well, that actually leads me to an interesting follow-up question, at least in my mind, is I wonder if this behaviorally will change what employers do year after year, and maybe they retain status quo to a degree, maybe are less likely to move carriers or make big changes, or do you think that would be negligible?
It's like the tail wagging the dog
Okay.
on some of this stuff.
Okay.
And I think that, it's so interesting how much fear drives behavior relative
Sure.
to compliance. Relative to the cost of running a health plan and the cost of claims, compliance is not very expensive. And at least in my mind, and I know it's easy for me to say, compliance is not that hard, right? It's just so much of the behavior around compliance is fear-driven due to lack of understanding. And that's something I'm really on a mission to change, right?
Yeah. What I know from your perspective, I kind of probably already know the answer, but ideally, like if an employer really values compliance on an ongoing basis, then there needs to be an ongoing relationship, right? This isn't just, hey, one phone call a year to say, Jen, I need you to tell us if we're compliant again. It's like, let's evaluate this, whether it's quarterly or semi-annually, but then let's maintain a relationship, because as you make a change to your plan, you're going to need to have a reevaluation of your compliance as well.
Exactly. And the relative cost of looking at something like this once a year, I got to tell you, is minuscule compared to the potential cost savings of making sure that you're doing a complete and total evaluation of the plan vendors and, is it being administered correctly? Things like that.
Well, and even relative to what you said on their plan spend itself, but relative to the potential penalties that might be levied against them if they don't pay for compliance, right? It's one of those things that you look back and go like, well, yeah, I could drive around without insurance until you need your insurance, and you go, well, I should have bought that insurance that was $100 a month or whatever it is.
Absolutely. Yeah. And in this mental health parity space, I got a lot of people who say, well, do I really need to have this? And can I get this done when the DOL comes knocking? And the answer is no, you don't have time when the DOL comes knocking. And I mean, this world is crazy. I mean, now the DOL is under investigation by the office, the OIG is investigating, like the government inspector general is investigating the DOL because they're not happy with how quickly the DOL is investigating employers.
Yeah. The investigators. I always love that. That's our government for you. But what about, so I want to make sure we don't move on from mental health parity as one of those three categories too quickly. So what else would you add? Am I missing anything, questions to clarify there?
Quantitative treatment limitations. Okay. And this is where I have a confession. I spent about a decade looking at summaries of benefits and being like, oh, the copays match. We're fine.
Yeah.
That's not the way to do this.
Really? Okay.
Yeah. It's a claims analysis. It is a substantive claims analysis. It's a mathematical claims analysis. Because it's not just do the claims match. It's or do the numbers match. It's actual based on claims experience.
Okay.
It's just a more complex test.
Okay.
And those rules came out right when ACA implementation was going on. I was tired and I didn't read them at the time.
That's funny.
I confess, apparently me and everyone else in the ERISA bar, and nobody remembered to explain to the industry what we were supposed to do.
Okay.
I went back and read them about 2 years ago and realized I had been doing it wrong. And I think everybody else was too.
Okay.
So it is an actual analytical quantitative analysis that needs to be done based on real claims data.
And what does that analysis look like? So we got the claims data. You've looked at it. Go, okay. Results are you're not within parity. Like, do you make recommendations at that point? Like plan design changes?
Yeah,
what happens?
It's plan design changes.
Okay.
It's whether or not you can keep the copay or the coinsurance or things like that on the mental health benefits.
Okay, cool.
Yeah.
So what is usually the issue is, do they rework the mental or health plan, or do they rework the medical plan, or both?
You got a choice.
Okay.
You got a choice.
Got a choice, right?
You got a choice.
What's easier? I mean, if you had to suggest.
Depends on what you're looking for.
I'm going to get too many.
I know.
I also ask questions that don't have real answers either, but that's okay.
No, it really depends. It depends on what your goals are. It depends on how much spend it's going to cost. There's a default reaction that, oh my goodness, I have to make the change to mental health. You don't. You could make the change on the med search side.
Yeah.
So there are options.
PlanSight is a complete game changer in the world of insurance brokering. As a broker, you know how time-consuming and error-prone the traditional RFP process can be. Well, what if I told you there's a better way? PlanSight is the only end-to-end RFP solution on the market made specifically for benefits agencies. It's like having a superpower that gets you an average of 8 to 10 hours back per employer renewal per year. And the best part? PlanSight supports all carriers, all funding types, and all group sizes for over 20 different benefits. If you're ready to make your RFP process faster, more efficient, and more profitable, it's time to call PlanSight. Visit plansight.com now to book a free demo and discover the future of insurance renewals.
Well, and what ends up happening, obviously, a lot with these medical plans, and you have sure seen this firsthand, right, is a lot of people are self-funding as a result of the cost of just delivering health insurance continues to go up. And so they feel like when I'm fully insured, the only results or the only way I can actually get the cost to come down is to sort of dilute the quality of my plan itself, right? Raise those deductibles, raise those copays. And there's a natural reaction, well, that's what I can do. You start to self-fund, and there's obviously a lot more things that you can do. That might actually lead you to the result of improving the quality of your medical plan, but then obviously then the mental health benefits have to follow suit, right? So it could go either direction, right? But ultimately my hope is that both of those things improve concurrently and continue to improve over time, and we can help these employers control the costs to deliver those things as well.
Absolutely.
Am I smoking crack thinking that's possible?
You are not.
Okay, good.
You are not.
Yeah, okay.
You are not. The other thing that I will share, which has been probably one of the highlights of my career, is that going through this process and doing comparative analysis, and I've been part of several hundred at this point, has been, we have found a number of situations where employers have been surprised to find mental health parity violations in their plans and changed their plans as a result of this exercise.
Good.
And it's been amazing.
Yeah.
They just didn't know, right? I didn't realize there was an exclusion of this type of substance abuse benefit. Or, wait, I didn't know that ABA therapy was a mental health parity violation. You know, this exclusion of ABA therapy was a mental health parity violation, or other related issues. And the plan gets changed.
Yeah.
And that provides, you know, real enhancements of benefits to real people, sometimes hundreds or tens of thousands.
Well,
depending.
it's amazing, you know, having understood the procurement side of things, right? What happens when you go to market for life and disability, or you go to market for your medical plan? You spreadsheet 5, 10 line items out of 150 or whatever the case may be, and then you put those together and you pick from that limited data set and you go check, and you assume no plan changes happened or whatever, or you assume the only thing changed was we went from 70 to 80% coinsurance. Like you said, though, the finer details that are in your policy, that if you read the policy itself or your consultant obviously guided you correctly, you would know that there's some things underneath the surface that did change, and you find yourself in a situation like that. So it's almost like a call to industry. It's like the procurement itself needs to be a little bit more robust than a lot of really basic spreadsheeting, unfortunately, that happens today. So soapbox off, and we'll move on to the next topic. Okay, so the second thing you said was it claims around prescription drugs?
Prescription drug data collection.
Okay, so tell me, we didn't cover this over coffee, so I'm a little bit naive on this subject, so tell me what you mean by that.
So it has nothing to do with prescription drugs.
Okay.
I know, so confusing. What is happening?
Okay.
What is happening here?
All right.
I know. Well, it sort of has a little bit to do with prescription drug. This is RxDC. Prescription drug data collection is a new-ish creature, also a subject of the CAA, because it is the gift that keeps on giving.
Yeah.
And it started, I guess it started last year, or in the beginning of 2022. But on June 1st of 2023 was the first time that there was a new component required to it. So what this is it is a CMS data collection process where they are trying to understand sort of where all the money is going within our community. So a big piece of it is trying to understand prescription drug spend, but they are also trying to understand where medical spend is going.
Okay.
And they're trying to understand what it is. So I try to describe it as being sort of like a budget. Okay, so they want to understand the money coming in and the money going out. And so they do it, they have it, there's couple of sets of files that they're collecting. So they call them the P files and the D files. I kid you not. So there's the P files just identify the names of the files. It's like demographic information.
Okay.
But then the D files, we've got D2 through D8 are all of the money going out in the health plan system, right? So D2 is files from TPAs, and they say here's where all the claims dollars are going in the system, and then the D3 through D8 are where all the prescription drug money is going in the system. And so for the past 2 years, for the 2020 and 2021 years, they collected all the information about the goes out money, all the money going out in the system. But then for 2022, they wanted to know also about the money coming into the system, because they're trying to understand where are the employee and employer dollars coming in and where is it going out. You can kind of begin to understand what the government wants to do with this information, right? They're like last to the party.
Yeah.
Okay.
Yeah.
But if you really want to understand the economics of the employer plan system, and they're also looking at other types of plans too, but you need to understand both the money coming in and the money going out. Okay, so the TPAs and PBMs are responsible, and carriers too, for reporting all about the prescription drug spend and all about the medical claims spend. But starting in June of 23, they also want to know how much money's going in.
Okay.
And not just the total premium or premium equivalent going in, but the breakdown between employer and employee dollars.
Okay.
Guess what data TPAs and carriers don't typically have?
Contribution data?
Bingo.
Okay.
So they're generally speaking taking care of for you, or for the employer, the goes out data. They can tell CMS no problem, and they can do this on an aggregate basis, so it's not really even that hard where the money went.
Yeah. Yeah.
But they cannot tell CMS breakdown between employee and employer dollars. And it is the plan sponsor's responsibility to make sure this happens.
Okay.
For the first time ever, by June 1st of 2023.
Okay. Did anybody do it?
Yeah, some MZQ clients
Some
did.
MZQ clients clearly did. Yeah. Well, to be fair though, I mean, the reporting of the contribution spread itself, or what the tiers are charging employer employee within those tiers, it's not super difficult, right? The employer should know what they're charging in their handbook or showing, right?
Yep, not super difficult.
Okay.
But has to get done.
Yeah.
And they had to sort of say how many employees they had and what the spread was.
Okay.
And the TPAs and carriers don't have that data natively. And this was fully insured and self-funded.
So what happened? Did the carriers make it up, or did they just say, well, no, that's the employer's responsibility and we're not providing it, or what ended up happening or getting reported?
Mixed bag.
Okay.
Most employers are still out of compliance with this requirement.
Okay.
Still required, still necessary. There are employers who are still doing it like late, and they are still accepting late filings.
Well, I'm going to say this would take 5 minutes, right, to actually supply the contribution data
Pretty easy.
in a single email.
The actual filing is extraordinarily difficult to do.
Imagine that.
Imagine that. Doing it with CMS really, really hard.
Okay.
Something that we can help do pretty easily, but the physical act of doing it is very, very difficult.
Yeah. Okay.
But most employers have found themselves in situations where they don't understand that this is a requirement, and the responsibility is on the employers. Most employers still don't understand they have that responsibility.
Okay.
Most TPAs did not help with this. A lot of carriers, even in the fully insured market, did not help with this.
What is it? Ultimately, the onus is on the plan sponsor, right?
Correct.
At the end of the day, it's a really weird situation, I'd say, to be in, because a plan sponsor now is the one that's obligated, which they should be. They're the fiduciary. They are the plan sponsor. You own the plan. But all this regulation is sort of pushing the buck in their lap. But a lot of what they're supposed to do is limited by their access to some of this information. And also, all of a sudden, you just got to now be compliant with a new law that came about, which you realize you haven't been compliant in the past. And it's weird that the employer, to me, is the one that's almost being punished as a result of this.
And it feels that way.
Maybe it just feels that way.
No, I mean, it does feel that way. And in some ways, it is that way. It's a jurisdiction issue.
Okay.
It's a jurisdiction issue. Because the federal government doesn't have the ability to get at the other parties in this situation.
Okay.
So it's the only people that they have jurisdiction over.
Well, I mean, honestly, though, at the end of the day, if you light a fire under the employers and they're obligated to do this, you know, the end result is it's gonna get done ultimately, right? Or maybe some big fines will be levied, some people will be punished. Hopefully, I hope examples aren't made just for almost punitive reasons, just to show, hey, comply or else. But I think once they are, I think, you know, this, like we were talking about over coffee, net positive for the industry. My hope is generally that is the case, and I think you said you shared that sentiment, right?
I do.
Okay.
I do, ultimately, but it doesn't feel that way some days,
right now.
right?
Yeah.
And I mean, you know, I can't tell you how often I'm like, well, I get asked, you know, in the quiet whispers, well, what's the penalty if I don't do this? And, you know, on this one, RxDC, I mean, the federal government has huge penalty authority, right? I mean, most of these things, potentially the answer is $100 per participant per day. Likely to happen? I don't think so, but could it? It could.
I imagine it probably will to somebody. Again, almost
Right.
just as like, hey, just by the way, we're serious about this, you know, and, you know, probably see some publicity around that and whatnot. But, you know, again, my hope is that it moves the industry itself in the direction we all want it to go. More
Right.
transparency, more cost controls, that the vendors are actually doing their jobs in the equation, you know, and what they're being sold to the employers to do, they're actually doing, you know, et cetera, et cetera. Before we move on, though, I do want to cover that third component, which is, if anybody is getting tired of me saying gag clause attestations on this podcast, I apologize. Maybe this will be the last time we mention it for a while.
I hate them.
But we
I
need to
hate
talk about them, and it's important to talk.
Yeah, we do have to.
We do have to. I mean,
know
it's
we
up to
have
you. If you
no,
want to say,
we
I've
absolutely,
covered it already.
No,
but
we
okay.
have to, but I hate them. I also hate that they're called gag clauses.
Okay.
I'm like, can we name them something else?
Yeah.
No, we can't, but I hate them.
I mean, that's a legal term, right? A gag clause?
No, it is
Yeah.
in fact a legal term, and I just hate them. I hate them so much.
Okay.
I hate them because the government has set me up for failure, I've decided. Like, there's no good answer.
Yeah.
There's no good answer. Because, and we've had conversations with the DOL about this. There's no good answer because there is a legal requirement that employer plan sponsors file attestations that they have no gag clauses. And I believe that most have gag clauses.
Yeah. Well, so do that. If you don't take that a step further, gag clause, what does that mean? Right?
A gag clause is a provision in a contract between an employer and a certain type of vendor that they have entered into since December 27th, 2020, that would basically restrict the ability for an employer or plan sponsor, the employer plan sponsor, or a participant, beneficiary, or business associate to have access to certain information about the plan.
Okay.
Yes, and that data is price or quality information
Okay.
or de-identified health information.
But I would say it would be impossible not to have limited access to certain things, right? Because they're not the ones compiling the data. They're trusting a vendor like a TPA or a PBM to compile said data, right? So is it even possible to have zero gag clauses?
It's difficult, particularly because in the FAQs, they've made it clear that those are both direct and indirect contracts.
Okay.
And so the indirect contract thing, it
Is
just...
it indirect with like a BAA or like a business associate?
Or downstream contracts are really difficult.
Okay.
It's with networks and things like that. So it's just really hard to be sure. And my real concern is, so sort of the workaround concept here is that employers would rely on these. So employers don't have access to all of these contracts to review to make sure that they haven't sort of entered into these indirect contracts.
Yeah.
So sort of the idea or the solution that the industry has come up with in this case is that employers are going to rely on like sub-attestations from their TPAs, vendors, networks. And then they're going to turn around and make attestations under penalties of perjury, et cetera, to the federal government based on an attestation that they got from their vendor.
Yeah.
But then you've got to read the attestations, and the attestations say things like, we, vendor, are in compliance with our requirements under the CAA. Well, that's delightful, and it's wonderful that the vendor is doing everything the vendor is required to do under the CAA. The vendor being in compliance with the vendor's responsibilities under the CAA does not mean that the plan sponsor is in compliance with the plan sponsor.
The standard's different then?
Yes.
Okay, yeah.
Yeah.
So and then you're going like, hey, I'm a little 100 life company that's self-funded and I'm doing business with insert big TPA name here who has 10 million lives and they're a huge company and they're attesting that they're doing their job. Like, well, I don't know. Wouldn't I presume I can attest to the same thing, right? Like there's a big power dynamic and difference of scale that's involved there. So like, what is that little employer that's not sure other than hire MZQ for guidance, or maybe I do hire MZQ. What do I do if I don't feel comfortable attesting? I don't have an option to not attest right now, right? Or do I?
ClaimDoc is a medical claim auditing and member advocacy company. We provide fiduciary services to employer-sponsored benefit plans and allowing them to create an environment where we ensure that the benefit plans are being charged in a fair and reasonable basis.
My business is basically people, and it become a real simple transition. We thought it was going to be far more complex. I've saved, we'll say, hundreds of thousands of dollars. I could not say enough about ClaimDoc.
Well, that's an excellent question, right? So the law says that you need to attest, and theoretically, there could be enforcement for not attesting. There also could be enforcement for misrepresenting something to the federal government.
Yeah, and which one's worse, right, on balance? Like, I'd rather not misrepresent something to the federal government, just on balance.
On balance, I would rather people not make a misrepresentation to the federal government also, right? Yeah. So I hate this because the choices are make a misrepresentation to the federal government or not do what they told you to do.
Yeah.
But, common sense would tell you better not to lie. I mean, I'm not saying it's a lie. That was probably a little bit
What our moms and dads told us? If you can't say anything nice, don't say anything at all. Like, I can't say anything nice. I can't attest.
We're going to go with the kindergarten rule on this one. Like, lying might be a little strong, but don't attest to something that you are not able to attest to.
Right. So then there's got to be some checks and balances, right? To go, well, I cannot in good faith attest. So what?
So here's what I would say, though.
Okay.
Here is what I would say. Do not use this as a get out of jail free card. This is what you should not do. Don't decide, oh, this is too hard. I can't attest. I heard Jen on this podcast. And therefore I'm going to ignore the whole thing. Like, not okay. It's just ignoring the fact that there was an attestation requirement and deciding it's too hard. I'm just going to ignore it. Like, create a record as to what, if you're going to not attest, there should be an administrative record as to why you didn't attest with some good faith effort associated with it. Right? So don't just ignore a federal reporting requirement because it was too hard.
Well, you did your due diligence. Like you said, you collected evidence. You documented the reasons why you feel uncomfortable attesting and because of X, Y, and Z. I've got it on record. This is my statement. Then what? You wait. What do you do after that? You
work in good faith to get into a position where you can make an attestation.
Okay, so you have, let's say there's 4 items that I'm uncomfortable now attesting because. Now I need to go solve for those 4 items?
Yeah.
Okay, and then document that I have now at least solved for the 4 items that I'm aware that it made me uncomfortable to attest. Am I oversimplifying that?
No, you're perfect. You're perfect. Work with those vendors, see what you can do, ask them.
Okay.
See what's necessary.
But this is also new, right? This is also fresh. We're sort of in the middle, in the thick of it at the moment, so I don't think anybody has the answer. But I do like at least the standard of acting in good faith and proving that you've acted in good faith with the spirit of the law itself. Okay.
You can count on people like me.
But you're the lawyer. I'm not the lawyer.
You can count on people like me to still be working with the regulators to say, listen, the community needs some help here. Can we get some relief here? Like we need maybe some other options or, an opportunity to attest that we're working on it or something like that. And people like me are certainly out there in the world actively advocating for some relief on this.
Sure. And I think honestly, because like you said, this sort of was like shoveled in the height of COVID into a very voluminous bill that you said was like 3 times as big as the ACA or something crazy.
It's pretty big.
It's pretty big, whatever the number is. It's like, the fact is a lot of people were just pushing stuff in the table and there wasn't a ton of oversight. Now it's all in there. So you would hope that over time, as more scrutiny is placed upon these regulations, that we massage them a little bit and make them a little more simple to comply. So people are adherent, and we're ultimately still getting towards the outcome, at least that was intended originally. Maybe I'm too aspirational, maybe I'm too optimistic, but that is my hope. It sounds like, though, you think that might happen.
We're working on it.
Okay, we're working on it.
We're working on it.
So let me ask you, before we move on to kind of big picture of healthcare and sort of move towards the end of the podcast, is anybody able to really attest at this point, you think? Is it possible to do so?
We've got some ideas and some aces up our sleeves on ways to get there potentially.
Okay.
But it depends on sort of plan structure and things like that, and sort of how simple your plan is or how much control your plan has, natures of your network. So maybe.
Maybe.
Yeah, maybe.
Maybe. That's my favorite place to be, is maybe there's people that are compliant. But anyway, so the interest in kind of like wrapping this thing towards the end, and obviously we've covered a lot, which I've had a lot of fun. Let me just say right now, I've had a lot of fun on this podcast. Let's move into kind of big picture healthcare stuff, Jen, right? Compliance, like I said, is cool right now. It is cool. And I think based on what I'm hearing from you, it's going to be cool for this foreseeable future because you guys are going to be so important. But maybe the back end of this, let's say regulators get it right, you in the compliance side help these employers get it right. What do you think happens as a result? Or what would you maybe even like to see happen as a result?
I'd like to see sort of the levers sort of get to a place where policy can help sort of drive us to a place that we get a seat at the table in really helping to improve the system.
Okay.
Right? So a lot of the drivers behind some of this stuff that makes us all want to pull our hair out is really trying to improve the ecosystem, right? So if you look at something like mental health parity, which is, enough to make us all crazy, the goal behind that is to provide better mental health benefits.
Yeah.
Now, I've been in plenty of conversations and plenty of moments where, I'm at the top of the list of people who think this is, a very silly law. Okay?
You parse your words very nicely there.
I want to make sure that this stays G-rated. Very, very silly law. But the intent behind it is ultimately to provide better health benefits at reasonable cost.
Yeah.
And I think it can do that. Might not be doing it the most efficient, best way, but I think it can do that. And I think that, the idea behind compliance as an overall piece of this puzzle is to help create guardrails. Is it done perfectly? No, nothing
ever is.
Nothing ever is. But certainly my goal is for this to be, a seat at the table, along with, all of the other modalities that we have in benefits in getting towards this common goal of providing and having a system that makes sense.
Well, so you think maybe the disconnect right now is Congress is enacting these regulations without enough input from the industry itself, experts on the other side of the equation that will be impacted by it. So if we, not me, but you and some people like yourself that know the law well, actually got to be vocal and be proactive in helping with some of this legislation, would that be nice?
Certainly working on it, right?
Okay.
I'm certainly working on it. So I don't know if we talked about this or even if you knew this, but I am currently the vice leg chair for NABIP. There you go.
Yeah, awesome.
Absolutely. And so everyone should come to Capitol Conference this coming February. But, I think that we do have the opportunity to affect change and to have a voice in what our regulations and what our legislation looks like. And there's an opportunity to not just sit around and complain about what this regulatory scheme looks like. And it is designed to, help protect the system. Yes, some days it feels onerous and annoying, but there are also, there's a flip side to this world, right? So, one of the conversations that I have actually a conversation that we had over coffee this morning was about captives, right? And how captives work. And MIWAs are always part of the conversation that we have around captives. And why are MIWAs so heavily regulated? And what are the rules about MIWAs? And I have this conversation about control groups and MIWAs all of the time. And at some point in that conversation, somebody says to me always, well, why do we have to deal with all of this? And what's the big deal? Well, the big deal is we have a history of this country, of really bad actors pooling together unrelated employers and setting up sham health plans and defrauding people out of, tens of millions of dollars and, putting together sham health plans and not having health benefits to back them up.
Yeah.
So there is a real value behind these regulatory schemes.
Yeah.
It doesn't feel like that.
Well, they just don't seem to be executed well.
Right.
Even there's value and good intent behind them.
Right. Even when there is good intent behind it. But there's also times where there's bad intent. And so when you're pulling your hair out and, your compliance is the last thing in the middle of the fourth quarter and you're mad at the compliance people, it's hard to see the value in it. But it is there. And I think that's important to remember.
Yeah. Well, so if I were to think about compliance, is it best to do it immediately after renewal? Because if I make some plan design changes or vendor relation change, okay. So, and then as ongoing basis, right? Continue to evolve my plan, swap role, swap people that I'm doing business with. It just needs to be an evergreen process, right?
It is an evergreen process, but I always tell people first quarter is my fourth quarter.
Fair enough.
So everyone always tells me, fourth quarter. And I'm like, I don't want to tell anybody, but I'm pretty slow in November.
Yeah.
January, February is really rough for me.
Yeah.
Yeah.
Cool. Well, so why don't we do this, Jen? Maybe your closing thoughts. We've talked well over an hour, I believe, right? Around an hour or so. And this has been fun. Really has been. But what do you want to leave the audience with as we part?
Compliance does not have to be a burden. It doesn't have to be hard. It can be a value differentiator and an opportunity to really help people. I think is the important thing that I would leave the audience with. As hard as it can feel at times, it is an opportunity to really kind of dig in and provide true value. And it doesn't have to be something that you're an expert in. So we had this conversation this morning too. I use the custom home analogy to describe a self-funded plan and describe what we do as being the electricians. So nobody expects the advisor to know, and nobody expects the general contractor as the advisor to know how to wire the house for the electricity.
Right.
They just expect the general contractor to know a really good electrician.
Yeah, to hire the right person.
Hire the right person.
Right.
And have the right partners to help you.
Yeah.
So.
And we were in that analogy, we came to the conclusion maybe a captive is the architect, right?
Yeah. The captive can be the architect.
Yeah, captive's I wanted to fit the captives in there somewhere.
And I think we made the underwriter the plumber.
Yeah, underwriter was a plumber, and there's some other parts as well, I forget. But I think
Sorry to the underwriters out there.
The conclusion that I have is like they say in life, right? Everybody needs a good lawyer. Everybody needs a good mechanic. I think every plan needs a good compliance consultant is the conclusion I have from today. So I appreciate, Jen, you coming down again, lending your voice to the podcast. Super excited to release this one as well. And who knows, maybe we'll do these ever so often since compliance is an evergreen subject, right?
It is indeed.
Awesome.
Thanks for having me.
Thanks again, Jen. Yeah.